Hello, my name is Dr. Michael Albrecht, and I'm an internal medicine physician and founder of BrightMed Clinic, a primary care internal medicine and weight management clinic in Lansing, Kansas. And this talk today is going to be about gout. This presentation is for informational purposes only and not intended to diagnose or treat disease or any. In this talk, we're going to talk about what gout is and what the symptoms are, what causes gout, how to diagnose gout, how to treat gout, and how to prevent gout. So what is gout? Gout is inflammation of one or more joints due to precipitation of uric acid crystals in the joints. So there's this substance called uric acid, some people call it urate, that floats in our bloodstream. It's a breakdown product of DNA, specifically the purine components of DNA. And when uric acid levels get higher and higher in the bloodstream, it predisposes to gout because it becomes more likely that the uric acid will precipitate in the joints. When the uric acid precipitates in the joints, say the big toe joint, our immune system doesn't like it and inflames the area. About 5% of the US population has been diagnosed with gout. The symptoms of gout include redness, pain, heat, and/or swelling, also known as inflammation, in one or more joints. The most common joint affected is the base of the big toe joint. It can also inflame bursa, which are sacs of fluid near joints that help to lubricate the joints. We have bursa in our shoulders, in our hips, near our knees, and near many joints that help to lubricate how the joint moves through space. And these can also become inflamed with gout due to the uric acid precipitating in or around the bursa. You can also get nodules under the skin with gout. These nodules under the skin in gout are called tophi. One tophi is a tophus. So these typically occur in people who've had gout for a while and not necessarily if you've been newly diagnosed with gout. Locations for these tophi or nodules can be in the joints and the bursa, in finger pads, and in tendons such as the Achilles tendon. We talked about this a little bit, but gout is caused by precipitation of uric acid in joints or the bursa, and it leads to an inflammatory response because our immune system recognizes the uric acid crystals as foreign that are inside the joint. So just about anything that can lead to higher uric acid levels in the blood is a risk factor for gout. One of these is simply a genetic predisposition to high blood uric acid levels. Normally, our kidneys help to clear some of the uric acid from our bloodstream, but some people kind of under-excrete the uric acid because of genetics, and that leads to the higher blood uric acid levels. Male sex is also a risk factor. One of the reasons for this is that estrogen in women helps to get rid of uric acid in the blood. Older age is a risk factor for gout. A diet high in purines also predisposes to gout. This includes red meat, organ meat like liver, seafood, shellfish, gravy. Fructose is a big one like soda, and alcohol. Obesity predisposes to gout. Chronic kidney disease predisposes to gout. And there are several medications that can increase uric acid levels and also increase gout risk. These include diuretics like hydrochlorothiazide that's used for blood pressure control, or furosemide, also known as Lasix, used as a water pill. Testosterone is another one. Insulin And then there are less commonly used medications such as calcineurin inhibitors, such as tacrolimus, and these medicines are used to prevent organ transplant rejection. So if you've had a kidney, heart, liver transplant, you might be on one of these medicines to prevent transplant rejection. And then there are medicines used to treat tuberculosis, which fortunately we don't see a lot of in the United States, but those medicines include pyrazinamide and ethambutol. There are also some medicines that aren't used to treat gout or prevent gout, but are used for other conditions that can also lower uric acid levels. So there are certain blood pressure medicines that lower uric acid levels and may reduce the risk of gout, and that includes losartan and amlodipine. Estrogen, we already talked about, can potentially lower uric acid levels. And then there are certain diabetes medications known as SGLT2 inhibitors that can reduce uric acid levels. Brand names of these drugs are Jardiance, Farxiga, Invokana, and there are others as well. Some diseases can mimic gout. The most important for doctors to rule out is a joint infection, because if a joint infection goes untreated for very long, it could cause significant joint damage or other problems. Pseudogout is another one. This is caused by another crystal called calcium pyrophosphate that can precipitate in joints. It can look just like gout, but is not gout because it's not caused by uric acid crystals. Skin infections known as cellulitis can mimic gout. Rheumatoid arthritis is an autoimmune type of arthritis that affects many joints throughout the body and therefore can mimic the inflammation of joints associated that occurs in gout. Osteoarthritis is wear and tear arthritis of the cartilage in joints and can mimic gout. And then something called psoriatic arthritis that's associated with psoriasis can also look like gout. So how do I know if I have gout or something else? Your doctor will probably be needed in order to help figure that out. But if it's the big toe that is red hot, swollen, and painful, it very well could be gout. If it's another joint like the knee, it could be gout, but it also could be something else. And doctors sometimes will drain fluid from a joint with a needle, such as the knee joint, to see if it's gout or something else. Especially they want to rule out an infection. Gout will show what are called negatively birefringent crystals under a polarized microscope. You don't need to know that, but just know that under a polarized microscope you would see yellow and blue crystals if it is gout. And notably, gout and infection can occur at the same time, so you could have both at the same time. So you may need antibiotics and medication to treat the gout. X-rays of the joint or ultrasound imaging may also be helpful in some cases. Say somebody starts having a gout flare. They have a red, hot, painful, swollen joint, and they need to be treated. How is it treated? Well, there are three primary types of treatment. NSAIDs, which includes ibuprofen, naproxen, indomethacin, diclofenac, and others. Those are the first-line medicines to treat gout. If you can't use the NSAIDs, which we'll talk about on the next slide, you could use colchicine or prednisone. So we talked about these medicines on the prior slide, but NSAIDs are non-steroidal anti-inflammatory drugs. They include things like ibuprofen, naproxen, which is Aleve, or indomethacin. These are the first-line therapy for gout, but there are certain times when you don't want to use NSAIDs, such as when you have kidney disease. If you have a stomach ulcer or you've had a stomach ulcer before or stomach bleeding, you probably don't want to use NSAIDs. And then congestive heart failure would be another reason to avoid NSAIDs. NSAIDs could cause side effects such as high blood pressure, inflammation or ulcers in the stomach, worsening kidney function, and worsening congestive heart failure symptoms such as swelling and fluid retention. Colchicine is something that you can use if you cannot use NSAIDs. Colchicine should not be used in patients probably who have diarrhea at baseline, because the most common side effect of colchicine is diarrhea. There are also medicines that increase colchicine levels and can increase toxicity of colchicine, and so you'd want to avoid those medicines, and your doctor would need to help you figure out which of those medicines they are that increase the colchicine levels. Potential side effects of colchicine include diarrhea or GI upset, bone marrow suppression, and muscle enzyme elevation, possibly muscle weakness and pain, known as myopathy. Corticosteroids are the last type of medicine that you can use to treat a gout flare. That includes prednisone, dexamethasone, or methylprednisolone. Sometimes if the joint is large enough, like the knee joint, we can just inject a steroid into the joint. We don't have to treat you with a pill steroid. But these steroids are used when you can't use NSAIDs or colchicine. You may not want to use these steroids if you have diabetes or high blood sugar, because these medicines will raise your blood sugar significantly. And we often try to avoid these medicines in congestive heart failure. Dexamethasone may be a little better tolerated for heart failure patients if we do need to use it. But side effects can include high blood sugar, but also long term, there are many side effects to these corticosteroids that can include cataracts, poor wound healing, thin bones and fractures, and psychiatric problems. The good news is that gout flares can be prevented, and we typically try to prevent gout flares with medications if you've had at least 2 or more gout flares in the past year. So if it's your first gout flare, we may not want to put you on long-term medicine to reduce a gout flare, but if you've had 2 or more, we'll definitely consider it. Maybe if you have really high uric acid levels, or if you have something called a tophus, which we've talked about before, that's depicted on this slide. You might want to use medication to reduce uric acid levels. So if you look at the picture on this slide, that's a tophus. That's uric acid crystal deposition in and around the joint. And so these look like nodules near the joint. Gout is prevented both with dietary measures and also medication. You can focus on the diet with reducing red meat, organ meat like liver, alcohol, seafood, and fructose. But you probably will also need a medication if you want to lower uric acid to the appropriate target level. And we want to target a level of less than 6 milligrams per deciliter if there are no tophi. But if you have a tophus, like is shown on this slide, you'll want to have a level less than 5. The main medicines used to lower uric acid levels and prevent gout are the following: allopurinol, which is the most commonly used medicine to lower uric acid levels. We would start at a 100 milligram daily dose, 50 milligrams daily if you have advanced kidney disease, and probably would increase the dose by 100 milligrams every few weeks until you're at your target uric acid level, either less than 6 or less than 5 if you have a tophus. And the maximum dose of allopurinol is 800 milligrams daily. Side effects are usually none, but there is a rare side effect that's pretty serious called allopurinol hypersensitivity. It could cause severe skin reactions, fever, liver inflammation, and even kidney failure. Other considerations for allopurinol is in those with Asian or African descent, we should be performing a genetic test called HLA-B 5801 allele. If you have this genetic variant, then we want to avoid allopurinol because this predisposes to allopurinol toxicity, such as allopurinol hypersensitivity. Another medicine we sometimes use to prevent gout by lowering uric acid is called febuxostat. The brand name is Uric. Its dosing is starting at 40 milligrams and increase up to a dose of 80 milligrams if needed. There is a black box warning that Uric could cause cardiovascular events, and you would use it if you can't use allopurinol or allopurinol is not effective. There are some others that we use rarely called probenecid and pegloticase, but since we use them rarely, I did not type out the dosing, side effects, and other considerations. So what should we do when a preventive medication is started? Well, the first thing that you need to know is that when you start a preventive medicine, such as allopurinol, it can actually cause a gout flare when you first start it. And this is because when you lower uric acid levels suddenly, it kind of destabilizes these crystal uric acid deposits in the joints, and it can cause a gout flare. And so taking allopurinol for the first 6 months, you should also take an NSAID or colchicine or one of the preventive meds, or sorry, one of the treatment meds for 6 months to prevent a flare when you first go on the medication. So an example of that is that you would take naproxen, which is Aleve, 220 milligrams. It's like one pill of Aleve over the counter once a day, along with the allopurinol for the first 6 months of being on the allopurinol. And this is to prevent a gout flare while we're lowering your uric acid levels. This is my reference for the talk. It came from the Annals of Internal Medicine Journal, which is a great journal that I get a lot of information from. And in summary, gout commonly causes pain, swelling, redness, and warmth, which is also known as inflammation of the big toe, but it can also affect any joint. There are medications that treat gout, and there are different medicines that prevent future gout flares. A diet to lower purines is recommended, along with appropriate medication for anyone who has been diagnosed with gout. Monitoring uric acid levels over time to ensure that they are at the target level will be needed. Thank you.